Do you ever come across children that have really difficult behavior, aggressive, violent, anxious, nightmares, and you know have gone through a lot, they've experienced a lot of trauma, and you think they would really benefit from trauma treatment with, for example, EMDR or CBT, but they just don't want to, or their family or carers think they're unstable and they can't really do it, or you're not sure whether they're stable enough or not. The Sleeping Dogs method is for those children, and with a tool with 19 different reasons for children not wanting to talk about their memories or not being motivated, you make an analysis of what could be the key issue here with this child or with this family. And treatment then focuses on those barriers for those families or children. And so treatment becomes a lot shorter because you don't focus on everything and you don't have to work on everything. Another element of the Sleeping Dogs method is to bring therapy outside the therapy room. And caregivers, parents or child protection workers or school teachers, foster care workers, and they can work with the child to motivate them. And because they've got a relationship already, it's much easier to collaborate all together than for a therapist to try and get the child into the therapy room. We use simple language to explain what trauma is, how it impacts the brain and the body, and why children have certain behaviors. And those explanations are illustrated with pictures and images, and it's explained to children from the age of 5 and their parents and caregivers, and so the child understands what's happening with him and what therapy can do for him or her, and how he could benefit from that. And with that knowledge, the child is more able to choose whether he wants to do it or not. And working with the child's biological parents to acknowledge the child's innocence about what happened and that the violence or the abuse was not his fault and he wasn't neglected because he was worthless. And that can be messages that can really help a child feel less guilty or less bad about themselves and take away their shame, and in that way remove a barrier for them to talk about their memories. Collaboration is one of the key elements in this method. Because the therapy needs to come to the child, therapist collaborates with the child protection worker if that one's involved, foster care workers or residential staff, caregivers or biological parents, abuser parents, depending on what the child needs and where the child's barriers lie. Child protection workers can provide the child with information about what's already known about his history or why a child's been taken into care. They can explain to children that wasn't their fault, or they can explain to children that whatever they will tell, and if they tell about their traumatic memories, most of the things are already known, so it will not have any consequences for contact or any reunification plans. And so child protection workers can provide that information, which can help children to know and decide what to do. Caregivers can help motivate the child by pointing out daily life situations where they have difficulties that are related to their traumatic memories and use the metaphors that the child has learned. Or they can use the exercises that the child can use, for example, to store away bad memories in a safe deposit box or go to their safe place. With the biological parents, often they have their own trauma history or they have depression, anxiety, drug use, how they can have their own mental health issues. And for those parents, it can be really difficult to change. And this method focuses more on compensating what their parent can't do rather than trying to change them, because they've already tried and it didn't work anyway. And so parents that can't really talk about things or are really afraid their child's going to ask difficult questions, how they can make a plan on how to deal with those questions or involve a family member that can help. If you want to know more about the Sleeping Dogs method, you can read it in this book. You can order it online, or you can join us in one of our workshops all over the world. You can find more information on my website, and you can also find a tool with the 19 reasons why children are not motivated or don't want to talk about their traumatic memories. Hope to see you at one of our workshops.